Welcome. In this video, we shall talk about stomach ulcers. My name is Dr. Kibet from the Center for Open Distance and E-Learning at Machakos University. What are stomach ulcers? Stomach ulcers, also known as gastric ulcers, are painful sores in the stomach lining. Stomach ulcers are a type of peptic ulcer disease. Peptic ulcers are any ulcers that affect both the stomach and the small intestines. Stomach ulcers are sores in the lining of the stomach or small intestines. They occur when the protective mucus that lines the stomach becomes ineffective. The stomach produces a strong acid to help digest food and protect against microbes. And to protect the tissues of the body from this acid, it secretes a thick layer of mucus. And if the mucus layer is worn away and stops functioning effectively, the acid can damage the stomach tissues, causing an ulcer. We have three types of ulcers. One is what we call peptic ulcers. And these are ulcers that develop in the stomach lining or the small intestines. Number two is what we refer to as duodenal ulcers. And these are the types of peptic ulcer that form in the upper small intestines. And finally, we have what we call esophageal ulcers. And these are ulcers that develop inside of the esophagus. It's good to note that the ulcers share similar characteristics, but are identified by their location in the body. What causes ulcers? One, an infection with the bacterial Helicobacter pylori. Two, long-term use of non-steroidal anti-inflammatory drugs known as the NSAIDs. These such as the aspirin, ibuprofen, or naproxen. 3. Rarely a condition known as Zollinger-Ellison syndrome can cause stomach and intestinal ulcers by increasing the body production of acids. 4. A class of painkillers known as the NSAIDs can increase the risk of stomach ulcers. 5. And the less common causes of ulcers includes the following: excess stomach acidity or hyperacidity. This can also occur for a range of reasons, including genetics, smoking, stress, and some specific foods. What are the symptoms of ulcers? 1. Dull pain in the stomach. 2. Weight loss. 3. Nausea or vomiting. 4. Bloating. 5. Feeling easily full. 5. 6. Pumping or acid reflux. 7. Heartburn, which is burning sensation in your chest. Anemia, whose symptom can include tiredness, shortness of breath, or pallor skin. 9. Dark tarry stools. 10. Indigestions, also called dyspepsia. And finally, not eating because of pain. If you have these symptoms, you are likely to have ulcers. Let's talk about diet. Dietary changes can also help prevent stomach ulcers from developing. These are: 1. Fruits and vegetables. Eating a variety of fruits and vegetables is a key to a healthy digestive tract lining. These foods are rich in antioxidants, inhibit acid segregation, and contain cytoprotective anti-inflammatory properties. 2. Fiber. Diets high in soluble dietary fiber reduce the risk of developing stomach ulcers. 3. Probiotics. These are foods that contain active bacterial content such as probiotic yogurt. This can help reduce Helicobacter pylori infection. Vitamin C. This is a powerful antioxidant and may be effective in helping to eradicate Helicobacter pylori, especially when taken in small doses over an extended period. Fruits, legumes, and vegetables such as oranges and tomatoes contain high levels of vitamin C. Zinc. Zinc, these are micronutrients and is important for maintaining a healthy immune system and healing wounds. Oysters, spinach, and beef contain high levels of zinc. 6. Selenium. This may reduce the risk of infection, complications, and may also promote healing. Brazil nuts, yellowfin, tuna, halibut are recommended for their high selenium content. 7. Avoiding alcohol and caffeine can also reduce the risk, as they both cause the body to produce more gastric acid. This can lead to stomach ulcers. What are the risk factors? Certain behaviors and factors increase the chances of developing a stomach ulcer, and this includes frequent steroid use, smoking, overproducing calcium and hypercalcemia, genetics, consuming alcohol frequently. Stomach ulcers are more common in individuals over 50 years of age. People can develop a stomach ulcer at any age, but they are much less common in children. The risk in children is higher if their parents smoke. Let's look at the NSAIDs, drugs, and stomach ulcers. This is a group of painkillers known as the NSAIDs, and it carries a risk of stomach ulcers. The two best known NSAIDs are aspirin and ibuprofen. The risk of ulcers increases if the drugs are taken in high doses or regularly for a long time. Stronger NSAIDs drugs, such as those that need prescriptions, are riskier for stomach ulcers than those that can be bought over the counter, OTC. People should always check levels and talk to pharmacists or a doctor about any concerns with using painkillers. Yes, let's look at how ulcers can be treated. Treatment should vary depending on the cause of the ulcer. Most ulcers can be treated with a prescription from a doctor, but in rare cases, surgery can be required. It is important to promptly treat an ulcer. So, treatment of these ulcers involves the following. 1. Changing the type of painkiller if the cause is thought to be NSAIDs drugs. Trying the test and treat approach if the cause is through Helicobacter pylori bacteria. 3. Once the cause has been removed, the symptoms of stomach ulcers can be treated by protecting the ulcer from acid while it heals. And the drugs that a doctor can prescribe includes the following. 1. Proton pump inhibitors, PPI, that block acid-producing cells. H2 receptor antagonists, which prevent the stomach from producing excess acid. Antacids and halogenics, drugs that protect the stomach lining, such as pepto-bismol. It's also important to avoid drinking alcohol, smoking, tobacco, and any trigger foods during treatment. Pain may be relieved by eating, drinking, or taking antacids. Diagnosis. Diagnosis and treatment will depend on symptoms and the severity of the ulcers. To diagnose a stomach ulcer, a doctor will review a medical history along with the symptoms and any prescriptions or over-the-counter medication one has taken. To rule out Helicobacter pylori infection, a blood, stool, and a breath test may be ordered. With a breath test, you will be instructed to drink a clear liquid and breathe into a bag, which is then sealed. If Helicobacter pylori is present, the breath sample will contain higher than normal levels of carbon dioxide. Stomach ulcers are often treated by removing the cause of the problem. Doctors allow the symptoms of the stomach ulcer by asking questions about how the pain feels, where and when it happens, and how frequent and long-lasting it has been. This process helps to narrow down whether there is a stomach ulcer or not. Your doctor may also ask for a stool test or a breath test to find out whether the stomach ulcer is from Helicobacter pylori bacteria. If there are more serious symptoms such as bleeding, the doctor may require further testing, which may include endoscopy, and this is a camera inserted at the end of the long, thin, flexible tube to look at the gut lining. A biopsy may also be taken. Perium anemia. This is a thick liquid that allows X-ray to be taken of the gut. And finally, the effects of ulcers and Helicobacter pylori. If ulcers are not treated, what happens? It can cause the following: 1, bleeding from the ulcer site that can become life-threatening. 2, penetration, which occur when the ulcer goes through the wall of the digestive tract and into another organ, such as the pancreas. Perforation, which occurs when the ulcer creates a hole in the wall of the digestive tract. Obstruction, blockage in the digestive tract, which is due to swelling of inflamed tissues. And finally, stomach cancer, specifically non-cardiac gastric cancer. So that marks the end of my presentation today, where we have been discussing about stomach ulcers. If you have any questions, if you have any issues, you can contact me. You can also subscribe to get any other new video whenever they are posted. You can also like or even share to your friends. Thank you.